Can babies be born with diabetes? Understanding neonatal diabetes. Neonatal diabetes mellitus is the term used to describe the diabetes in a newborn. This rare sickness affects approximately 1 in 100,000 to live births and manifests within the first 6 months of life. Neonatal diabetes mellitus is mostly caused by a genetic mutation. It is a monogenic disorder caused by the inheritance of a single gene. A high blood glucose level results from the infant's insufficient insulin production in non-diabetic mothers. Type 1 diabetes mellitus is not the same as neonatal diabetes mellitus. Type 1 diabetes is an autoimmune illness in which the body's immune system attacks and destroys insulin-producing beta cells in the pancreas. Type 1 diabetes is a chronic illness that often affects children older than 6 months. In contrast, neonatal diabetes mellitus is not an autoimmune disease that develops in the first 6 months of life and resolves on its own in 6 to 12 months. Two varieties of neonatal diabetes mellitus exist. Permanent neonatal diabetes mellitus. Half of newborns diagnosed with permanent neonatal diabetes mellitus, PDM, have the disease for the rest of their lives. In some parts of the world, 1 in 260,000 babies have it. Transient neonatal diabetes mellitus. In transient, the condition disappears within 6 months but has the potential to return. According to current theories, PLAGL1 and HYMAI are the two genes that cause 6q24 Tunisian dinars. Both of them can be found at location 6q24 on chromosome 6. Whether permanent or temporary, fetuses with neonatal diabetes grow improperly in the womb and may be small for their gestational age. This is called intrauterine growth restriction. What are the symptoms of neonatal diabetes? Urine is one way that the body excretes glucose when blood glucose levels are high. Many of the early symptoms are brought on by this and may include increased numbers of wet diapers, increased appetite, dehydration, which genes are responsible for neonatal diabetes. Diabetes in infants is a genetically and clinically diverse condition. There are currently more than 20 distinct genetic subgroups of neonatal diabetes that correspond to distinct clinical manifestations of the illness. Mutations in the ABCC8 and KCNJ11 genes, which encode the SIR1 and KIR6.2 subunits of the voltage-dependent potassium channel, respectively, are the most frequent cause of neonatal diabetes. Insulin secretion in response to glucose levels requires the potassium channel to function properly. About 40% of neonatal diabetes patients have a mutation in the potassium channel gene. Individuals with these two gene mutations are susceptible to sulfonylurea therapy, which can significantly improve their glycemic control when used in place of insulin. International guidelines have resulted from this, recommending genetic testing be referred for as soon as neonatal diabetes is clinically diagnosed. Mutations in KCNJ11 and ABCC8 can result in transitory, permanent neonatal diabetes, or DEND, developmental delay, epilepsy, and neonatal diabetes syndrome. While all of the KCNJ11 mutations that have been found so far have dominant effects, ABCC8 mutations can have either a dominant or recessive effect and are frequently inherited. How is neonatal diabetes diagnosed? When your infant's blood or urine contains higher than normal glucose levels, your doctor will diagnose you with neonatal diabetes. Type 1 diabetes and neonatal diabetes can occasionally be confused. Given that a genetic mutation causes neonatal diabetes, genetic testing can aid in the accurate diagnosis of the condition. What treats neonatal diabetes? Insulin is frequently used to treat neonatal diabetes. When particular genetic alterations are identified, oral drugs may be prescribed in certain situations. For about half of the cases of neonatal diabetes, glibenclamide tablets can be used as a treatment in place of insulin. These individuals require larger dosages of glibenclamide than those prescribed for type 2 diabetes because they have a mutation in the KCNJ11 or ABCC8 gene. Glibenclamide not only lowers blood glucose levels but also helps with development delay symptoms. If you or your kid has neonatal diabetes, it's critical to know so that you or they can receive the appropriate care and guidance, such as stopping insulin. Can neonatal diabetes be prevented or cured? A genetic mutation is the cause of neonatal diabetes. Although there isn't a cure or prevention at this time, it can be controlled. Neonatal diabetes goes away in around half of the babies who are diagnosed with it, although it can come back at a later age. Consult your baby's healthcare professional as soon as you suspect that they may have neonatal diabetes.